Hello, I'm Nikki, the librarian for pre-licensure nursing students at UIC Chicago. Today we're going to be talking about the importance of patient education. Another term you may have heard is health literacy, and it's interrelated. Educating your patients is not a one-time thing. It is important for all patients to understand their health care so they can better care for themselves and others. It's commonly held belief that only patients who have English as a second language or are uneducated need health education. Just because someone is wealthy or holds advanced degrees is no assurance of medical knowledge. A patient who understands the why of treatment is more likely to be compliant. Someone with high blood pressure needs to restrict their salt because it pulls more fluid into the bloodstream, raising pressure in the vessels. If you explain this to them, they are more likely to reduce salt. A patient who understands what their medication is for and has a basic knowledge of how it works is more likely to take it correctly. Antihistamines dry up secretions, causing dry eyes and dry mouth. It's important to drink lots of fluids while taking them to prevent dehydration. Remember, knowing is half the battle. Even though we know how important it is to educate our patients and enhance their health literacy, it doesn't happen as often as it should because of multiple barriers. Barriers to staff include time, not knowing how to explain complex concepts, and not being aware of resources to help. We'll get into those later. Barriers for patients are language barriers, low overall literacy/education, and assumption of understanding. The importance of this last one cannot be overstated. I'll give you a couple examples from my own personal experience. My father was a brilliant and educated man. He prided himself in his intelligence. He was diagnosed with cancer. He assumed that since he was smart and well-read, he was expected to understand, so he never asked questions. He didn't want his doctors and nurses to think he was stupid. My daughter broke her arm last winter. Her doctor shared the results via the Health Record app and made no attempt to adjust the language for a layperson. Here's a quote. "There is a mildly comminuted dorsally angulated supracondyle fracture of the right distal humerus, large effusion and prominent soft tissue swelling, no dislocation." As a former nurse, I can make my way through that statement. As a mother, it took me a couple read-throughs to make sure I was understanding it and it tracked with what had been communicating with me at the hospital. This brings me to my final example. As part of my nursing education, I spent a day in the OR watching a 10-month-old boy undergo an operation. It was same-day surgery, so he went home with a huge bandage. His mother did not speak English. A translator was on hand for discharge, and she was given some Spanish language reading materials. She did not know how to get to the pharmacy downstairs, much less what to do when she got there. I hope those materials she was given included in-depth instructions on how to change that bandage, because I know I would freak out when I saw what was underneath on my firstborn child. Staff at the hospital might have done an admirable job with the operation, but they failed their patient and his family when it came to ensuring quality aftercare.